Hi, this video is created by Providence Home and Community Care regarding falls risk factors. Improve your understanding to prevent falls. Every second of every day, an older adult falls. Many of these falls cause injuries, loss of independence, and in some cases, death. The good news is that falls can be prevented. Tell a healthcare provider right away if you have fallen, if you are worried about falling, or if you seem unsteady. Are you at risk for falling? Try this to find out. Hold up one finger each time you answer yes to the following questions. I have fallen in the past year. I use or have been advised to use a cane or a walker to get around. Sometimes I feel unsteady when I'm walking. I steady myself by holding onto furniture when walking at home. I am worried about falling. I need to push up with my hands to stand up from a chair. I have some trouble stepping onto a curb. I often rush to the toilet. I have lost some feelings in my feet. I take medicine that sometimes makes me feel lightheaded or more tired than usual. I take medicine to help me sleep or improve my mood. Or I have felt sad or depressed. If you're holding up 4 or more fingers, you may be at risk for falling. Research has identified many conditions that contribute to falling. These are called risk factors. Many risk factors can be changed or modified to help prevent falls, and Providence Home and Community Care can help. Risk factors include difficulty with walking and balance. Activities that improve balance and strengthen legs can prevent falls and can help you feel better and more confident. Check with your healthcare provider about the best type of exercise program for you. Risk factor number 2, taking medications that affect your balance or make you feel unsteady on your feet. Keep an updated list of your medications. Show your healthcare provider or pharmacist all medications, including any over-the-counter medications, to see if any might be creating issues. Risk factor number 3, hazards in the home. Most falls happen at home, so keep floors clutter-free, add grab bars in the bathroom, and use non-slip mats. Have handrails and lights installed on all stairs. Keep items you often use in cabinets you can reach easily without having to use a step stool. Risk factor number 4, vision problems. Being able to see clearly can help prevent falls. Have your eyes checked by an eye doctor at least once a year. If you have bifocal lenses, consider a pair with only your distance prescription for outdoor activity. Risk factor number 5, cognitive concerns. Fall risk is higher for those with decreased ability to think or with cognitive impairment. Changes in cognitive function might lead to poor judgments and decision-making, such as placement of a walker or ability to gauge distance. While physical exercise is effective in reducing falls rate, working on both physical and mental ability can yield better results. There are strategies you can implement that can help you remember things, so share your concerns with your healthcare provider. Risk factor number 6, dizziness. Feeling dizzy or lightheaded can be a sign that you're at risk for falling. Take note of when this happens most often. Is it when you first sit up, or when you move your head from side to side, or after you take certain medications, or maybe when you're hungry? If you notice that you feel dizzy or lightheaded often, report it to your healthcare provider. Risk factor number 7, incorrect footwear. Wearing proper shoes and having healthy feet are important to preventing falls, especially if you have diabetes. Make sure you have shoes that fit, that don't have too much of a heel, and provide adequate traction for slick walking areas. Your healthcare professional can also teach you about what footwear might be best for you and how to keep your feet healthy. Risk factor number 8, incontinence. Having to use the bathroom often or constantly having the urgent need to go can also increase your risk for falls. Your healthcare professional can help set a bladder training schedule or present other treatment ideas. Now that you have learned more about some of the risk factors that can lead to falls, talk to your healthcare provider about how to minimize these factors and make your home safe. And know that Providence Home and Community Care is here to help.